I want to continue our focus on the opioid crisis. Last year, more than 2,000 people died in Massachusetts alone. This is powerfully important to me and to the people I represent and to everybody who sits on this committee, and I think in the United States Senate. Now, Dr. Adams, as Indiana Health Commissioner, you saw the epidemic up close when you dealt with the HIV outbreak in Scott County, Indiana. There's been a lot of discussion about that today, several references to your work there. When you established a syringe exchange program, which was illegal in Indiana at the time when you first recommended it, and that the consequence is you help save lives and help contain that outbreak. So I just want to ask you a question, Dr. Adams. Why did you press for such a program, even though it was controversial and in some quarters politically unpopular?
Well, thank you so much for the opportunity to answer that question. And I pressed for it because it was the right thing to do. It was a scientifically sound thing to do. It was what I thought was necessary to save lives and stop disease transmission. But as I mentioned earlier, I also recognized that the knowledge base oftentimes isn't enough, and that we had to partner. The most important thing, as I mentioned earlier, that the governor and I did was go down to Scott County and talk to folks. And I don't want to take up your time, but I do want to say very quickly, ask yourself if I said to you, I'm going to open up a syringe exchange program across the street from where you live. The first thing you're going to say is, oh, no, you're not. And then you're going to say, come down and explain to me why this is necessary. And so partnerships are critical. The science has to be there, but it's got to be given in a sympathetic and empathetic way.
So the way I read this, your response, is you said you're willing to do something that's innovative, data-based, even if it turns out to be politically controversial.
I feel a trap coming, Senator.
No. We can be friends here, Dr. Adams.
We are friends. We are friends.
Good. So here's what I want to ask you. Are you aware that the American Medical Association recently endorsed developing pilot facilities where people who use their own drugs can do so safely under medical supervision?
I am. I was there when they debated it.
And so what's your view on that?
My view on that is that the science is not quite there to the extent that it is for syringe exchange programs, but we've got two natural pilot programs, one in Massachusetts and I believe one in Seattle, and I look forward to carefully reviewing the data. And even if we do have compelling data, just as I said with syringe exchange programs, we still have to come back to local control and local conversations.
So reviewing the data and studying and perhaps expanding the studies of supervised injection facilities as a public health tool in the fight against the opioid epidemic?
I think it's one of many tools that should be considered in the tool chest, and communities need to be leading that conversation about whether it's right for their community.
And we need a Surgeon General who's also going to lead that conversation.
I've led that conversation across the country and, quite frankly, across the world because of the unfortunate HIV outbreak that occurred in Scott County.
So thank you, Dr. Adams, and you are right. I hope that we very much are friends because you are an evidence-based, committed physician, even if it is politically unpopular. And I think that's what we need right now in addressing the opioid crisis. We truly do need all hands on deck, whether they are politically acceptable or not politically acceptable. We have got to do what the evidence tells us may have an effect. We study it, we find out, and then we follow through. I think that's powerfully important, and that's what I want to see in a Surgeon General. So thank you, Dr. Adams. I'll be submitting other questions for the record, and I'm going to yield back my time, Mr. Chairman.